And we're back with our regular medical segment that we bring you each Thursday here on our program, brought to us by Kaiser Permanente. Joining us today on the program today, Dr. David Keschner, who is the Assistant Chief Head and Neck Surgery with the Alton Sand Canyon office of Kaiser Permanente here in Orange County. Doctor, welcome to the program.
Thank you. It's a pleasure to be here.
Good to have you with us.
Thank
A bit
you.
about yourself, where you grew up and your medical training.
I grew up in the South Bay in LA County and spent most of my life out here, and went to training in Orange County at UC Irvine. Did my medical school and my residency training here locally in Orange, and proud to be a member of the medical community here in Orange County.
Right. Well, you're active with Kaiser, as we mentioned, and of course, as we have each Thursday on the program, one of the fine doctors from Kaiser. You know, head and neck surgery, that sounds pretty invasive, pretty serious. Let's talk a bit about your practice and kind of how it's evolved and how you got into the specialty.
Yeah, sure. Head and neck surgery really runs the gamut of everything. I think in the earlier days of medicine, we covered everything from the eyes to the brain and every part in between. Those areas have been segregated out, obviously, to ophthalmologists and neurosurgeons. But so today we focus mostly on tonsils, the throat, sinuses in the face, the ears, and those kinds of related problems.
We used to refer to somebody as an ear, nose, and throat specialist.
Yeah.
And you're the kind of the next step of subspecialty above that, I guess.
Well, we have tried to reorient people to our practices, so we tend to go by head and neck surgeons now to, I think, really reinforce the idea that we can provide the whole gamut of treatments from medical therapy to surgical therapy.
Right.
But yeah, we still go by the old moniker, ear, nose, and throat.
Right. Okay.
Yeah.
Obviously, you know, one of those basic things is breathing, and obviously those are the kind of people you probably start to see that have some breathing problems. Specifically our age group here, 55 plus, what are some of the kinds of things you see breathing related from this age community?
You know, there's really a lot of the same problems that we see in other demographics in the senior demographic for our patients. We see a lot of patients who have nasal problems that can range from nosebleeds. A lot of our senior patients are on aspirin or have maybe some high blood pressure, and because the nasal tissue becomes more fragile as we get older, it's more prone to bleeding. We see a lot of those patients. We see also patients who have all the typical symptoms of nasal problems: nasal congestion, postnasal drip, sinus pressure, facial pain, sinus headaches, all those kinds of things.
And I guess there's a variety of causes, which you need to find what the cause is before you can obviously treat these conditions. Let's talk about some of the treatments that are available. You know, some people, I know my mother was a big advocate of really blowing your nose hard. Now I've heard that maybe not be the wisest thing we can do, but what are some of the treatments you prescribe to your patients?
Well, there's actually, fortunately for me, in my practice, which is mostly related to sinus and nasal problems, there's really a whole range of treatment options for patients. And in fact, it turns out that a lot of the best treatments are things that are readily accessible for patients on the outside. They're over-the-counter types of treatments. One of my favorite treatments is a saltwater rinse that people can use. It's over-the-counter. There's a lot of manufacturers that make these kinds of products where you mix a special type of salt with distilled water and you irrigate out the nose. That's a terrific way to treat nasal problems because it washes out things that we breathe in all day long that may irritate the tissue in the nose.
Right. I know a lot of people use saline nasal spray as opposed to using a lot of nose drops. This would be a little more concentrated, and having tried it a time or two, it takes a bit of getting used to, I must admit, but it is effective. It does help clear out the nose. Yeah,
most people, once they start using it and get accustomed to using it, really won't give it up for any reason at all. It's so effective. The nasal sprays can be just a moisturizing agent, but these are really irrigations that really wash out the nose.
You brought along something. Is this the kind of a product we're talking about?
Yeah, this is a saltwater irrigation kit.
Let me show the camera here, Doctor, if I may. This is what this is called Neilmed Sinus Rinse, and it looks like from the back it's available at every pharmacy I've ever heard of. So
yeah, pretty much
a common over-the-counter product.
Available everywhere. It's a terrific product. I don't specifically endorse this one product. I don't have any relationship with the company, but I use it often in my practice. And it's very simple to use. It's just mixing a packet of salt water and sodium bicarbonate with some distilled water or filtered water, and using that to really just wash out the nose.
Yeah. Does it have to be heated? I've heard sometimes warm water works better.
I have a lot of patients that heat it. It can also be used in a neti pot, which is like almost like a teapot that you just pour into the nose. And the theory behind it is we spend all day breathing in dirt and pollutants and allergens, and this is a great way to wash those things out.
you were going to give us a little quick demonstration of this. Obviously, this is an empty one.
Right.
But in here, I guess this is what we're talking about. And this is a little small can. Sorry about that. Get a shot of this. But this is the actual product you'd mix with the distilled water, this little packet of stuff. And obviously, you'd buy more of these.
But you have to buy. This is just a sample kit that I give to my patients to start with. But all you'd really have to do is mix this packet, put it in the bottle that comes with the packet, put some distilled water in there, mix it up, and then apply it to both sides of the nose once or twice a day. And it's extremely, just by itself, it's a natural product. There's really no side effects to it. And just by itself, this and the same products that are from competing manufacturers are really effective at controlling symptoms. Just simple things like that.
Right. Now, this isn't for the person that has the common cold. This is for somebody who has persistent sinus problems, I guess.
Honestly, it can work for both. There's some studies that tell us that if you have an acute upper respiratory tract infection or a cold, that this can actually be very effective at helping mitigate the symptoms and also shorten the length of time that people are suffering from. But yes, you're right, we use it primarily for patients who have chronic sinus or nasal problems.
Specifically dealing with our age group here, 55 plus, are there specific sinus issues that tend to affect seniors more?
Well, again, I think that the tissue in the nose does change as we get older, and so there are symptoms that are more prone to occur in patients that are older that we don't necessarily see as much as in patients that are younger. Postnasal drip, for example, is a very common symptom in old elderly patients. It can cause a lot of the feeling that people have phlegm in their throat, they can't clear it when they're coughing. It can be very distressful, and that's something that we see a lot in seniors.
I guess sometimes that might be related to lung conditions or other issues as well, maybe.
Yeah, in fact, that's probably one of the hardest parts of really trying to understand what is the cause. And of course, we need to know the cause to treat the problems effectively. But something like acid reflux, that was also very common in seniors, can mimic those symptoms exactly.
Right.
It can be really hard to tease them.
Some people just seem to have allergies seasonally. You know, tree X, Y, or Z, or their girlfriend's cat that they see occasionally, or, you know, I guess there's a lot of things that can cause allergies.
Right.
What can you do in your practice to help? You're not an allergy specialist as such, but what are some things you can do, people who have persistent sinus problems or allergies?
Well, first of all, I think you hit the nail on the head. The first part of it is just really identifying whether there are actually allergies that play a role, because a lot of people can have chronic sinus problems or nasal problems that are not allergic in origin. But the ones that are, it's actually very helpful for us, because if we can identify what they're allergic to, we can actually reduce or mitigate their exposure. So we have allergy tests that are great. The old-fashioned way, which we still use, is to do a lot of scratch tests on the skin, so people, I think, remember that. But we actually can now just test your blood for all the common allergens. And if we can identify things that you're allergic to, we can offer ways to reduce your exposure, and we can also desensitize you through our allergy program.
Right.
And that sometimes by itself can also reduce your symptoms.
Well, part of your title is surgery, and I guess there are certain conditions that require you to go in there and do some serious surgery work.
Yeah, we tend to think of our treatment options as medications or surgery. We really, for this kind of a problem, reserve surgery for patients who have failed the full range of medical therapy. And so when we see those patients and they're appropriate patients, we have actually a lot of surgeries we can offer. Most are minimally invasive to help the nose function better or the sinus function better. The surgeries tend to be low-risk surgeries. They're outpatient surgeries. They're relatively easy to recover from, even in a senior age group. And they are, for the right patient, extremely effective at controlling these symptoms.
Great. Lots of good things you do to help us out. Doctor, thanks so much for sharing with us today.
You're very welcome.
If you have sinus problems or any other medical issues, you can find out more about Kaiser. Give them a call, of course. Find out more about the good services they're providing right here in Orange County. We'll be back with more as our program for today continues.